Just a second thing, just by way of visuals, the work that we do at GetWellNetwork is incredibly experiential, both from a patient and family standpoint, as well as from a provider standpoint. And so I want to give you a quick 30 seconds on. So in GetWellNetwork's world, we work in many organizations, and oftentimes what they deploy is what we call Get Well Anywhere. So we have become kind of one of the key partners in patient and family engagement. And so whether we're only working on the inpatient side, and we would call that Get Well Inpatient, we have turned kind of a patient room environment into a very interactive one where GetWellNetwork really becomes the digital care navigator for that patient and family. They order meals and they communicate with their staff, and there's a digital whiteboard, and they update their Facebook accounts, and all kinds of things you can picture at the point of care our patients are doing through their TVs, through tablets, and through their own phones. And then importantly, we have something called Get Well Loop, which really is a digital care management, or remote patient monitoring platform. We have a library of about 200 digital care plans. And so oftentimes pre any hospital visit and or post any hospital visit, our patients are kind of on their loops. And the whole notion of this is, can we keep them in the loop kind of around their care, and then we also do some cloud-based rounding. And so when we put these kind of three things together, we are oftentimes measuring what we call PEI, a person engagement index, which is a proprietary measurement tool that we built a few years ago to really figure out a person's capacity to engage in their own self-care. And if we can actually put a FICA score for kind of patient engagement on these patients, we can really figure out how many times you need to remind them, or, hey, does this require an in-person visit versus a digital care plan? So we are really helping our partner organizations understand people's capacity to engage in their own care. And through that, we can really help them be in the pilot seat, on their care journey, which is kind of what it is that we are working on as a whole. So if you go one more slide, Candace, by way of introduction, wanted to kind of give you a quick just snapshot of the time ahead. Then we'll kind of get current right away and have a discussion about some insights that we are gleaning from our COVID experience. But so if you think about, if you will, this Get Well Anywhere concept, it really is a very robust cross-continuum digital care management and remote patient monitoring solution. So we meet patients in a primary care office, we meet them in a specialty office, we might meet them in the ED. Wherever we meet them kind of in our organizations, we really become one of the core tools that puts like a digital tabletop on top of all the complexity for patients and families to kind of manage through their surgery prep, through their post-discharge recovery, through their plan of care, if they're a diabetes patient or what have you. We are currently at GetWellNetwork being pushed by our kind of client partners. Many of them are colleagues of yours across the country to really kind of expand, what we do, and to really kind of add capabilities around access, acquisition, and scheduling, so that you could really have one place, not a disjointed consumer experience, to be able to find the right physician in the network, schedule your appointment, do a telehealth visit, be managing your own care, and then come back and do the next things. And so ultimately, we don't believe it will be exclusively virtual, of course. This is a combination of how do you figure out how to stand up a dual delivery model that actually has a combination of physical and virtual encounters kind of going on throughout the life of a patient and family's journey. And so that's kind of how it is that we are kind of moving forward. And the last thing I thought we would just cover by way of introduction, if you click the slide one more time, Candace, is what's happening in COVID. And so as kind of the title of the session alluded to around navigating the new normal, we really have had an interesting seat in this journey since March. Within about 2 weeks, we stood up a bundle of what we call COVID-19 loops. And we actually got these loops out to about 200 organizations in a 4-week period. And some of the organizations are kind of listed here on this slide. Most importantly, we have really kind of become a central part of the command center in these organizations. And so we have put over 125,000 either COVID patients or folks that actually are struggling with symptoms and believe they might be COVID patients kind of on these loops. And so what's happening kind of in this is a tremendous amount of data on not only kind of what patients and families are experiencing, but inside the data. It's everything from, hey, in our communities of color, are they responding more or less to kind of what it is that we're doing? How is our staff, who actually also is actually getting sick at times, how are we actually helping them navigate, through this journey as well? And so it's been a incredibly intense 120-day period. we have learned so much about what we thought we knew for the first 19 and a half years, and also what we still have to learn, for the next 20 years. But we really are sitting here at an incredibly important time. We are communicating with patients and families by the minute right now, and we are connecting their communications back to these care management teams and command centers. And so we have gleaned a handful of insights that we thought would form the basis of our conversation today, and look forward to kind of sharing with you guys what we are learning along the way, and then certainly getting your input on what you're experiencing as well. So with that as a rapid kind of background on who we are and what we're up to, I thought I'd turn it to Candace and we're going to get into our discussion today.
Thanks, Michael. Thanks, everyone. Yeah, as Michael said, we've been so honored to kind of have this shotgun seat, if you will, with our partners around their response to COVID. And it's presented a lot of immense innovation, but also and opportunities, but also some challenges. So I just kind of wanted to run through a few of the observations that we've gleaned and kind of open it up to discussion across the way as we go through some of these. The first set of observations that we've seen on our end, unsurprisingly, of course, there's been this complete overnight explosion in virtual health, especially in the early days where in some cases it was the only way that you could reach patients or for patients to receive care. But I think over time, what we've seen, at least from our perspective, from the patient and family's perspective, is that it's been met with sort of a mixed reaction, if you will. On one hand, of course, there's a ton of satisfaction, especially with telehealth visits, the convenience of them, relatively few issues actually in terms of having trouble accessing that virtual visit and those links. And it just feels like a good use of time, both on the patient and clinician side, and certainly helps from a contactless and reducing transmission risk perspective. But on the other side, from a patient experience perspective, we've seen virtual wait times, in some cases, on average double what you would normally have in a typical office visit. And in that case, you can't just go down the hall and talk to the front office staff about what's going on. And then also, 50% of those who had these types of virtual interactions just felt like it wasn't on par with an in-person visit. And when we looked at our qualitative data, it's not just the long wait times, but it feels a lot more transactional to the patient when they're doing a virtual encounter. There's sort of little to no follow-up, and you can kind of see one of the quotes that we got from a patient here where it just felt like, again, no one was asking them, how did the visit go? There was very, very little follow-up as well, which is some of the feedback that we got that made patients feel even more isolated. I think part of when we kind of dig into our data and, and again, conversations with patients and families, one of the reasons why I think the reaction has been mixed is because the experience for patients on the virtual side has been maybe even more fragmented than the typical physical journey that they've experienced so far. And that, I think, again, presents a lot of opportunities from a provider perspective for loss of patient loyalty, leakage out of the system, a lot of opportunity for competition to come into play as well. And I think the reason for that is the velocity at which we adopted virtual health really meant that there was not an opportunity to really improve the process, right? So in a lot of instances, you're replacing a call with the call center person or front office person with a chatbot. You're replacing an in-person physician office visit with a video visit or a telehealth visit. And so again, I think that there's just been, from again, experience standpoint, there is still a lot of fragmentation across of that. And as we said before, I think from a virtual health perspective, that actually introduces a number of opportunities, because again, you can reach more patients outside of your geography, but that also means that there's more competition potentially from outside your geography, from retail and consumer centric organizations, from payviders. And again, because of the fragmentation and the challenges in follow-up with those patients that we've seen for a lot of our members results in, again, patient leakage, or you might have expected sort of a follow-up visit with that patient after telehealth, and a lot of our clients at least have been saying they're not seeing as much of that as they would like. So those are the first couple of observations that we've had. Would love to kind of open it up and hear about your experiences as well in this space. Are you guys, what are you guys investing in as it relates to virtual health, and does this sort of observation resonate with you?
Don't make us call on you, but we will if we have to.
I'll just jump in and start, Candace. Honestly, I think in fragmented sensibility, remote patient monitoring, and then the opportunities for telehealth have been available for quite some time. And it's probably a little bit more than close to 10 years ago that I actually went to the FCC based on an opportunity that was available to me to try to construct this type of model. And I think as a payer, there are significant, opportunities within it that benefit not only the plan, but if you have state contracts, the states and your performance under those contracts, but most importantly, the patient. Obviously everything can't be remotely monitored, but the sophistication that has been made available and that's evolved over the years, provides real opportunities, to use that again, right? To really just provide for enhanced patient care. Not really requiring patients to have to visit all the time, not putting the burden on the patients to travel. So when you deal with underserved populations, there's a real opportunity to significantly reduce travel costs, increase compliance, right, around patient appointments, and just overall provide for a better care. And so a lot of what you discussed so far definitely resonates with me because I do think this has been too long coming forward. It's unfortunate that the pandemic has occurred, but it certainly has thrusted us to really think more broadly about where those opportunities exist. And I just think that downstream, the benefits to everybody involved are significant. And so it's important to harness this as soon as possible.
Thank you for sharing that. And we'll talk a little bit more, actually. That's a couple of, the next set of observations that we have is directly about how COVID has opened the door, if you will, I think, for hopefully more adoption and usage of things like digital care management and remote patient monitoring. I'm curious, so we were talking with a client recently of a really large health system, and they were saying, again, the speed at which they had to move to virtual, even though they had been thinking about this for some time, really forced them to take, in their words, a little bit of a Frankenstein approach, like whatever works, like let's just get it out there. And then now they are thinking about sort of what's the go forward strategy, right? And having to actually think about going back and potentially redoing processes and even redoing technology selection about, again, what is our virtual care strategy going forward, and what are all the, again, processes, technologies, and people that we need, as opposed to what happened the last 4 months, which has been largely reactionary. Would love to kind of hear from the group whether you are finding yourself in a similar situation of having to, again, go back and potentially redo some of what has been put in place because of the pandemic.
Hi, Candace. My name's Greg Horner. I'm with U Chicago Medicine. And to comment on that, but also to tag on to what Brian was talking about, the silver lining for us with the pandemic was opening us up and pushing us forward with telehealth, which we had been planning for a long time. So we had a lot of the process in place, but pushing us forward really has helped us with some access issues. And as you guys probably know, we're a customer of yours, longtime customer of yours, and we've struggled with access for a long time. And so the positives of access to our clinical staff and the safety of it has really outweighed any of the negatives. And so as we've regrouped to try and reform some of those processes, it's something that hasn't been nearly as hard as we thought it would be.
That's fantastic. It's great to hear that you already put that groundwork in place, and we've seen that with other clients as well. Those who had already made investments and thought through their telehealth strategy or their care management strategy were really poised, fortunately, to respond quickly with again COVID, and those that were not quite there yet, I think we're kind of left struggling a little bit, pulling the pieces together.
This is Jennifer at Wellstar, and just to tag on to Greg's comment, I think we were similarly in a position where, from a technical standpoint, we were well poised, well into our planning process, had already launched, virtual visits to some degree, and this just accelerated things. But I think part of what we're having to go back and think about is the level of adoption, both by patients and providers. Where it was sort of forced upon everyone early on. As things have settled a little bit, we've started seeing drift back to, prior patterns, and understanding why some patients or some providers are balking. And you gave good examples. If a patient's experience the first time they try this isn't entirely positive, then they may be reluctant to try it again. And how do you overcome that? Similarly, we have a number of providers who we're seeing quite a number of patients virtually early on, but have really reverted to, much fewer virtual visits, particularly with providers that serve, a geriatric population, where the perception is they're not going to be able to do this well, or they've had to spend a lot of time with their patients just to get them comfortable with the technology. So I think, at a high level, everyone agrees that this is launching us into a new normal and that we need to embrace virtual visits. But the reality at the patient and provider level hasn't been completely natural in that respect.
Mm-hmm. Thank you for sharing that. One of the analysts we work with that covers the virtual health space pretty extensively said that, I think I may not get these numbers exactly right, but I think it'll touch on exactly what you were saying. Before the pandemic, they were seeing on average like 15% penetration of virtual visits, with people's sort of 5-year plans trying to double that number. At the height of the pandemic, they saw close to like 85 and 90% penetration. And they anticipate it will end somewhere in the like 50 to 60% range. And one of the big drivers that they noted was right now everybody's at home and you can have sort of personal conversations with your medical team from the comfort and privacy of your 4 walls. But as people start to go back to work and start to go back to like open office plans and open office spaces, there is sort of a question on like level of comfort in having conversations like you often are with your care provider in a more public setting, was also, I think, just one of the kind of interesting observations. But generally them predicting that like we'll probably end at 50%. And the next question is like, what will that 50% be made up of?
Mm-hmm. I'm actually curious for those who have, put their, virtual strategy in place, whether it's pre-pandemic or today. Just as Nakia was saying, I think what we're hearing is like there's this promise now, and the doors are somewhat opened around virtual health adoption, but the reality is, whether it's because it's a aging population or different population to engage, whether it is on the clinician side, whether it is looking at what's more appropriate as a setting of care or the acuity of the patient, it seems to be like needing to sort of weave in virtual opportunities with the physical ones, right? It's not going to be all virtual or all physical anymore. There's kind of going to be this weird hybrid environment that we'll have to navigate. And again, from the patient's perspective, it's already been challenging enough. There's enough fragmentation that it's hard to create those handoffs. I think both on the patient and the clinician side, now you're introducing different modalities, virtual versus in person. How are you guys thinking about creating that, those sort of the challenges that those transitions of care might create and kind of solving for that?
I would think that you would have to confront them as they arise. I mean, I do think that we could be overly cautious, right? And maybe a little bit too hesitant for concern of what we think the patient population is going to raise. But at the same time, you know, I do think if we're thoughtful about it, and as we share about opportunities for this to take place in various environments, we should anticipate what would be required to do that. So, you know, private pay patients, you know, going back to the office, you know, the question is, what are you gaining and what do you have to create in terms of a physical environment for a person to be able to do that in privacy? And a lot of our offices, you know, we have places where people can conduct private, you know, meetings. And so this couldn't, right, this might not be any different. The benefit is that now you don't have to set aside half a day, right, to go see your doctor for a visit that might take 15 to 30 minutes. And so, right, so I do think we're offsetting the burden, right, of patient appointments, because one of the things that I'm committed to believing is that the challenge that we see in getting patients to appointments is the inconvenience of it, whether it's travel, whether it's sitting in an office for an hour or two for something that only takes a few minutes, having to reschedule for another appointment. I mean, all those things are burdens that really do, no matter what your socioeconomic status is, that I do think holds people back from being more involved in their care. And so the opportunity is greater than the burden, I think, and we can solve for the things that we know could potentially be burdens in this time. You know, just as an aside, you know, you think about being in public and you hear some of the conversations people are having on their phones, you know, you wonder how much privacy there is anymore at the same time.
So true.
But there are things that do require that, and I think we can solve for that.
Have you guys found any results in terms of like your physician's willingness now to put schedules online, do open scheduling, et cetera? Like, has that been a sort of we've heard mixed things from some organizations, like lots of interest from their patient population, but really struggling still to get the providers online. I'm curious, Jennifer, Greg, others, if you've seen any acceleration in that.
I think we have. I don't know whether it is a cause and effect situation or just coincidental timing, but it's that was a challenge in terms of willingness of providers to put their schedules online and even allow for centralized scheduling until fairly recently, and now we're starting to see more willingness. I also wanted to just briefly comment, you know, I agree with Brian's comments, and I think it may be a misperception that privacy and ability to do virtual visits is going to be a barrier. One thing that we're observing even in our own workforce is that people who were in office situations prior are probably never coming back to the office full time. And so it may be quite easy to work from home that day if you've got an appointment scheduled. I think that's true in many industries, and so I think people will start to have a lot more flexibility than they've had in the past. So just wanted to throw that out there.
Yeah, thank you. I think it's great to hear from this group that so many of you are seeing this as an opportunity, and that, again, it's been a springboard for really accelerating your virtual care strategies. The next couple of observations kind of get at that directly. I think in particular, beyond sort of just the telehealth visit, we've seen, at least on our end, just a lot faster and more prevalent adoption of digital care management and remote patient monitoring type solutions. Obviously, with COVID, at least in our experience, these sorts of tools that were self-guiding patients across a digital care plan related to COVID was so important and essential as it relates to allowing the patient to self-manage, stay at home, mitigate sort of capacity risk for your own health systems, and prevent patients from unnecessarily reaching out to your care teams, so that your care teams could really focus on those who had high acuity and really needed their attention. And I think that experience has overall, again, like opened the doors and opened people's eyes to the use cases of this sort of beyond COVID. So a couple of things that we've noticed. One is obviously organizations who already had invested in care management and virtual care, they were, again, primed for really being able to pivot in their response to the pandemic. But we were also equally surprised, and I think that our clients were equally surprised, at how quickly the organizations that didn't have that infrastructure was able to create centralized care management. We work with a ton of organizations that like didn't really have that, except for like a very small team that would do transitions of care for COPD and diabetes, like your high risk discharges. But it was like a very tiny team, and they were very quickly able to stand up these centralized care management teams in response to the pandemic, and are now thinking about how to apply those more broadly. And then again, similarly, as I was saying, with these sort of digital care management tools, I think that is opening the doors, even for our clients who are heavy into population health and, participating in a number of different kind of ACO initiatives. I think they're realizing that care management, which has been so traditionally focused on the highest risk part of the pyramid, and primarily been a very resource intensive, sort of nurse intensive sort of team managing that population, adding digital care management tools and remote patient monitoring, again, has allowed those teams to really scale their reach beyond just the sickest of the sick and really get more proactive with the rising risk. And I think in our experience, we're seeing those organizations now think about leveraging these tools more broadly so that they can actually successfully take on more risk in their communities and with sort of both payer and sort of government models that they are participating in. The other thing that I'll say is that we've seen, and I'm sure you guys have experienced too, that the regulatory environment in this space as it relates to reimbursement also helps a lot with that. It's predicted to be very favorable as it relates to digital health, even going in the future. And even today, a lot of our clients are seeing, being able to get reimbursed for remote patient monitoring as it relates to COVID and other things that they were doing. So I think, again, both on the reimbursement side, as well as thinking about how these tools can extend your care management efforts, there's just organizations are thinking about how this can present opportunities for them. I'd love to kind of pause there and get reactions to that set of observations from this group. Are many of the folks on the phone involved in downside risk contracts, and is population health sort of a big part of your strategy overall?
Yeah, this is Sandra Gogan from Providence. So yes, all of that is what you're saying is true. What's interesting right now is that as we are trying to look at the expansion of remote patient monitoring to other conditions outside of COVID and other, that it really is doing it for one condition is one thing, but we in California where I'm at, we don't employ our physicians, and so some of those who are under employment under our foundations was able to get their hands on the technology, and then we have physicians who are affiliated with the hospitals, but they're in private practice, and getting technology compliance and standardization for them do this also has, is more difficult because of the technology stack that's open in their own office. And then on top of that, as we are learning our way through this, right now, everything's kind of primed for this because everybody's stuck at home, and calling in and seeing people are easier. But once they go back to work on the patient side, where the kids are at school and the parents are at work, if you do want to do a visit digitally, what does that happen? Does the parents still have to go and collect the kids and then go to home and sit in front of the computer? Or, how do you physically do that? And then for the physicians themselves, do you slot in these visits on top of their physical visits, or do you portion of their schedule out so they're only doing physical visits one day and other visits the other day? And we're just trying to learn it through, but it's something you're going to have to master. I think we feel that we're going to have to master. Incidentally, we had up to 70–80% penetration too, but it has slipped since we've been reopening our clinic, and it's back down to 15–20%.
Interesting.
And so we don't realistically. I think it's going to settle somewhere in the 30%, especially for those with chronic ill. I don't think it'll get to 50%, but I think it could get to 50% somehow if you can do it as a team-based type of a setting where they're calling in and multiple people are reviewing. I don't know. I think that right now it's a one-on-one nurse or physician with the patient, but I wonder whether or not we can get to more of that cognitive sharing model that was promised.
Yeah.
Thank you.
That's interesting. I'm curious, as a follow-up to that, it sounds like, there's been a lot of success, but then also sort of realism around the virtual visit side and where that's going to land, again, somewhere in the 30–50% range. Are folks on this call, have you been experimenting with or investing in, again, sort of more sort of digital care management, remote patient monitoring, something that is sort of checking in on behalf of your patients automatically? So not so much a virtual visit where they're talking with a nurse or a doctor online, but kind of using technology to almost in lieu of a provider, and then allowing that to alert providers when they need to intervene. I'm curious if this group has been piloting that, and if there's investment that you're thinking about going forward around how to, again, scale your care management resources.
Yeah, we're starting to hear executive teams say things like, all of our protocols will now include virtual care pathways, whereas before we might have had a couple of conditions where we were using sort of like virtual care management for elements of it. We have some organizations telling us that they're now starting to set the bar pretty high for having a companion virtual care plan to follow patients through many different types of experiences. Gisela, I see you on my screen. I'm curious, you've been nodding along. I'm curious what your thoughts are.
From Presbyterian Medical Services, we had during the pandemic a hybrid environment. Our clinics have remained open, and we have also engaged with patients virtually. So we had a telehealth program in place for many years before the pandemic. However, because of the rurality, we are a federal qualified health center. So we serve the underserved in the very rural New Mexico. So not of our patients have the ability to access to the technology to connect remotely. They don't have a cell phone, things like that. So our model was virtualizing the provider versus virtualizing the patient before the pandemic, and give them access to the technology, right, in our rural clinics. So that has changed with the pandemic, And we had to virtualize the patients as well, and together with the providers. And we have modified our strategy around the virtual visits. So we have invested in a platform that is integrated with our EHR. And I think that's been one of the success stories for the organization, because then you improve the experience of the patient. Everything is integrated. So the continuum of care, everything like the appointment can flow through the call center. The call center engages with the care management team to schedule and to improve, so that there is not so much of a waiting time. And we have been also looking into, we have chronic diabetic patients, right? And we want to invest into remote patient monitoring tools, so glucometers, so we can access. So we are definitively looking into that, incorporating that into our strategy going forward. And so far, the feedback we have from the patients is been great. Some of them obviously had problems to connect and engage, but all appreciate. We started with telephonic visits, and then we did the switch to virtual video visits. And both providers and patients really provided very positive feedback, because it's more rich experience than a telephonic visit, and that helped with the pandemic. They were feeling, they are seniors at home, feeling isolated, and the ability to connect, we really feel that we are supporting them, and we were surprised of the great positive feedback that we have received.
Thank you. That's so interesting. You all, like so many on this call, had a bit of a head start, but it's interesting to see how even with that, you really had to innovate quickly to kind of match the needs, the evolving needs of your different populations. Thank you for sharing that.
Before we move to the last couple set of observations, I know we have representation from some health plans on the line. I'm just curious your reaction to what I have on the slide around regulatory and reimbursement kind of favoring digital health. Like, would love your perspective as well. I can't remember who said they were from a health plan, or I would call you out by name.
So this is Brian again, and I do represent one. I would offer to you that the regulatory environment has evolved substantially around, this opportunity, to the extent that they at one time seemed to be rather entrenched with the provider community in their local states, where you saw a lot of those providers somewhat resistant to it, particularly being provided by a vendor like a Teladoc or otherwise. As a result of the pandemic, though, many of the states, and Pennsylvania, I know specifically during this time, stepped forward and said, this is what we're going to do. And as a consequence, they have appreciated the experience, and because generally it's well received. And so the regulation now is moving towards requiring it really as a capacity within the network for the upcoming year. So I certainly see them getting more relaxed as it relates to this, and reimbursement would be consistent with what you would have for an in-office visit. Not seeing any differentiation right now. That may come in the future maybe, but I seriously doubt it, since so many providers, physicians are very comfortable with this method now. And it's really gotten expansive very quickly, as I heard someone speak to that earlier. So I think it's becoming a lot more friendly regulatory environment for this purpose.
I think the one thing,
and I shouldn't say I think, I see it going that way.
One thing we're facing though, this is Patrick from Colorado. One thing we're facing though that's kind of a issue is where the cost lies for the visits and the technology. So when payers come down on the facility fees or think that, the facility fees are not applicable to these sorts of visits or experience, and that entirely hits the provider's the one that's seeing the entire benefit for the visit, then we're starting to have conversations about, well, where does that cost come from? Does that continue to be a loss leader, or is there some fee that then has to get transferred back over? So I think that's the missing part from a governmental perspective, is reimbursement for the infrastructure for all this.
And that's a fair call out. I think in many places where various states where I've worked, a lot of times for private payers, the facility fee was a non-issue. They just didn't pay it. More something that, of course, has always been driven by CMS and again, in the places where I've been without seeing the adoption at the plan level. But, you know, it's a good call out, and I do think it's a fair consideration as we move forward through this.
Thank you. Yeah, I've certainly heard that same feedback as well. Okay, well, last couple of observations and then we'll wrap. But the other thing that we've seen presented to organizations is opportunities for new revenue streams or business models, both with employers and payers. A couple of examples here, we've seen several of our partners being approached directly by employers. Some of them might have been working those partnerships before, but because of the need for, you know, retail and markets and many other industries to be constantly assessing the transmission of COVID and the safety of their own employees, asking for these kind of partnerships with health systems where maybe they can help with that kind of symptom monitoring and do sort of again, centralized care management or like virtual on-site clinic for their employees. Again, not new ideas, but I think accelerated by COVID a little bit. And then the other interesting kind of business models that we've been seeing is some of the organizations we work with have actually been pretty successful at delivering acute care services in the patient's home by using remote monitoring devices, a pulsometer, you know, other types of home monitoring kits alongside a team that might be visiting the patient in the home. And the success around that for COVID has made these organizations think, gosh, like, could we apply this to populations outside of COVID and maybe approach health plans in our market with this kind of new model? So anyway, just a couple of different ideas, but mostly around new business opportunities that are being presented. And I'm curious to hear from this group whether you're seeing more of that kind of direct employer relationship or, again, new ways that you're thinking about approaching payers with some of these models.
I think to your point, these aren't new ideas. In our organization, we were already in the process of pursuing a number of innovative approaches, you know, some of which included approaching employers in the area or looking at strategic partnerships. But I think to your point, this pandemic has perhaps accelerated some of those plans, probably in some other ways, you know, just the demands on our organization has caused us to pause on some other things. But, you know, all I think worthy ideas that we're probably already in some level of planning to start with. I'm not sure that we've had the time to pause and really stop and think about entirely new innovations that we weren't already considering on some level prior to the pandemic. I think those opportunities are probably out there. It's just that it's been such a challenge to keep up with the immediate demands.
Mm-hmm. Sure, that's absolutely fair. Well, any other closing remarks before we wrap up?
Just one thing. Go ahead.
Go ahead. I just wanted to resonate with one of your slides where it said that the regulatory environment really drives, especially also around innovation. So where we were doing considerations in our strategic plan for incorporating the remote monitoring planning, the key component on the timing for that is the support we are going to receive from reimbursement and, you know, Medicare, Medicaid, helping with us moving forward the program. So I think that definitely is a key factor.
Thank you. Mike, do you want to say a closing word?
No, just thank you all for the insights. We are in a dynamic period of time, as you all are, and just this notion of adoption of virtual health not going to go away, but being really thoughtful around how we incorporate it, into both physical and virtual, in almost rethinking care plans is just such a helpful push. So thank you all for your time.
Thank you, everybody. We'll see some of you over the next couple of days.
Thank you.
Thank you.
Thank you.